Welcome to this oral history interview, part of the expanding series of oral history interviews produced and preserved by the Missouri State University Libraries. My name is Tom Peters, Dean of Library Services at Missouri State. Today is Tuesday, December 2nd, 2014, and our location today is the Shealy Conference Center north of Springfield. Our special guest today is Dr. Norman Shealy, an extraordinary physician and healer. He knew by the time he was 4 years old that he wanted to be a physician. And he had no idea how far down the road this would take him. His ideas have been the foundation for pain management therapies used worldwide, and the Shealy program is the mainstay of chronic pain treatment and management sought by patients and physicians alike. He entered Duke University at the age of 16 and entered the Duke Medical School at age 19, and he's been involved in care and healing of many people, hundreds, millions of people, perhaps worldwide. Dr. Shealy, welcome.
Great to be with you, Tom.
Thanks very much. I also wanted to mention that you also recently donated your 200-acre farm here near Fairgrove, Missouri, to Missouri State University. Thank you very much for that generous gift. And you've also endowed the new Mary Charlotte Bales Shealy Chair on Conscientious Psychology at MSU.
Yes, I consider that my most important legacy.
Thank you. Thank you very much. And we're looking forward. So we wanted to chat with you today about just your life in general and your career and your thoughts on wellness and healing and a balanced life. So let's begin with where and when were you born?
December 4th, 1932. I was born in Columbia, South Carolina. Mm-hmm. But when I was 5, we moved to Camden, 30 miles away. Mm-hmm. So I grew up in Camden until I finished high school there.
Okay. When did you come to the Ozarks region?
Well, in 1976, we lived in Wisconsin. Uh-huh. Loved it there, but the taxes got as bad as the winters. And between 1976 and 1982, real estate taxes went up 800%.
Wow.
So we spent a lot of time looking, and it turned out that, first of all, Missouri is centrally located and travel a lot. Mm-hmm. And secondly, taxes mm-hmm. were 49th lowest per capita mm-hmm. in the country. Mm-hmm. So we moved here. The year we moved here, taxes in Wisconsin on similar property were 16 times what they are here. So we're very happy that we made the choice. Yes. Furthermore, the winters are a lot better.
That's right. Still get the 4 seasons, but winter doesn't last from Thanksgiving or from Halloween to Memorial Day like it does in Minnesota and Wisconsin.
Exactly. We averaged up there 40 days of 0 and below.
Yeah. Well, I lived in southern Wisconsin for 3 winters, as I like to say, and one summer it got above 80 degrees Fahrenheit 2 times in the entire summer.
Well, one of the years we were there, we had a farm there also, we actually had a frost the 8th of June.
Wow.
Which is unusual. But,
yeah.
My wife used to say, a temperate climate is intemperate.
So you went to Duke, both undergraduate and medical school?
Interned in internal medicine, even though I was going into neurosurgery, because surgical internships really suck. They are not educational, they are scut work. Mm-hmm. So I'm very grateful that I took a medical internship. Then I had a year of general surgery at Barnes Hospital in St. Louis. Mm-hmm. Great Professor Carl Moyer. Then I went to Boston at Mass General, where I had 5 years of neurosurgical residency.
Okay. And when we've talked before, I believe you said to me once before that you didn't abandon or reject sort of traditional Western medicine as it's practiced currently, but you outgrew
it. Well, basically, I honestly believe that drugs and surgery are essential, mostly in acute illnesses and injuries. But in chronic situations, I have not found for most people that drugs, and certainly not more surgery, are indicated. What actually happened is my first big invention was in 1965. I had this idea that we ought to control pain by stimulating the dorsal columns, the back part of the spinal cord. So I did all the animal work, finished it by 1966, and when I presented it to the American Association of Neurological Surgeons, it was the most controversial paper they'd ever had because it was in animals. And they were screaming and yelling, and I didn't know what I did, And in fact, the Journal of Neurosurgery refused to publish it. It's too controversial. So it was published in Anesthesia and Analgesia, but a couple of years later, when I presented just 8 cases that I had done in people, every neurosurgeon in the world wanted to do the procedure. And so all of a sudden, I was literally being sent from around the world, 400 patients a year, people wanted me to do the procedure on. But they were so damaged by that time with multiple surgeries and drugs, and I was selecting 6% of them. So in 1971, I decided somebody's got to find out what to do the 94% of these people. So that's when I really went out on a twig and founded the Pain Rehabilitation Center. And I started with sort of self-hypnosis and acupuncture and electrical stimulation on the skin, because I'd already developed that also. And then very soon thereafter, biofeedback came on the scene. And that introduced me to the really broad field of consciousness in general and meditation and all the related techniques. So I went back and got a PhD in psychology because I needed to understand the mind more, which neurosurgeons operate on the brain, but they don't understand the mind. And so my doctoral dissertation was essentially developing what I would call a software package for biofeedback training. Because you need guided imagery and all the related things. And so I developed this system that I called Biogenics, which, summarized 350 books and other things that I'd found on the subject. And that became the foundation for what we did for many people with chronic pain. It turns out, very quickly I learned that chronic pain patients were inevitably depressed. And the interesting thing about it is, we now know that people who are, let's say, borderline depressed already have a much higher failure rate when they have surgery, even if the surgery is indicated. That kind of stress throws them over the brink, so to speak. So over the years, actually, I have worked with 30,268 chronic pain patients, all of whom were also depressed. And my techniques, not only, in my opinion, and statistically speaking from everything we know, are the most successful I know in the world. We had an 85% success rate in people who had failed everything that conventional medicine has to offer. When I started, my average patient had between 5 and 7 unsuccessful operations. And they were addicted to Valium and some kind of narcotic, inevitably. And they weren't doing me any good. So we had to wean them off the Valium, wean them off the narcotics. And sometimes people got 50% better just by getting them off the drugs. Because the drugs are not very successful. Interestingly, I could say unequivocally that the top 3 groups of drugs in the world are not very good. Number 1 is statin drugs. I wouldn't take a statin for $1 trillion. The risk to my brain, my heart, my muscles, my peripheral nerves, I'm not going to take it. Besides, I can get my cholesterol where I want and have kept it that way just through common sense diet all these years. The second one is antidepressant drugs. They are among the least effective drugs in the world. The best single drug says it's 42% effective. Now, the placebo is 35%, so we got maybe a 7%. But probably 75% of people on antidepressant drugs have significant complications. Significant. So we take all of them, and there are 4 major articles that state if all the negative research studies had been allowed to be published, and 75% of them were not allowed to be published by the pharmacomafia, the net result would be 0. In my opinion, it's worse than 0. And the third group, interesting, is antihypertensive drugs. Even using 3 antihypertensive drugs, the success rate in controlling the blood pressure, forget about everything else, is about 45%. That's still not that much better than placebo. And it causes, among other things, fatigue and erectile dysfunction in almost everybody, all men at least. And so I have looked at all of these and looked at the alternatives. First of all, for managing cholesterol safely. Secondly, for managing depression. I get 85% of people out of depression within 2 weeks safely without drugs. And thirdly, over the last couple of years, I've actually worked with hypertensives. And I can get 97% of people normal blood pressure without drugs and safely. So it's because these safe alternatives are so effective and so safe. I mean, that to me is the ultimate. And of course, I've looked at a wide variety of these approaches. Certainly, all the stuff related to meditation, to self-hypnosis. The single most studied technique in the world for mind control, if you will, is autogenic training. It was developed in 1912 by a German psychiatrist, Johann H. Schultz. Published his first book on it in 1932. In 1969, the first of 6 volumes came out with 2,600 scientific references. And they showed that using nothing but autogenic training, we could actually cure 80% of stress illnesses. And of course, all illnesses are stress, in my opinion. I mean, sometimes it's a more serious stress, but the most common problem that people tell me they have, I feel stressed. I mean, it's just, I said, okay. Now, if you just shut up for a minute, just relax for a minute.
Take a deep breath.
And I can lead them in 3 to 5 minutes in the basic autogenic approach, and the blood pressure will come down to normal, almost inevitably. Now, I said the important thing is you really need to do this 18 minutes a day at home for 3 months. Then you'll have memorized it well. You can cut it down to about 5 minutes a day, and you'll continue to control your blood pressure. But it's just one of dozens of such techniques. And what I learned in what I developed as biogenics is the number one thing is essentially to believe that you can do something. Have a belief that it's. Number 2 is to stay in present time. And that's so key. So many people spend 90% of the day ruminating over stuff that happened in the past.
In the past? What about the future, too?
Some people ruminate on the future, but neither one of them is being here now.
Right.
And so the be here now, being in present time, is, to me, a key. I think I could say, I suppose that I ruminate on the future occasionally, but mostly I'm too busy taking care of the now to worry too much about the future. I mean, obviously, in my decision with Missouri State University, that's long-term planning for the future because I want things to continue. But on a day-to-day basis, I just get done what my mind says needs to be done today. And I have to say, and I can truthfully say, having practiced autogenic training since 1972, when I first learned it, I could say that 99% of the time I am in a positive mood. And the 1% of the time that something comes up, if I can't change it, it's gone. Now, if I choose to put my energy into it, I may spend some time on it. But most of the time, I can't change that. And I'm not going to waste my energy fighting for something that I can't change.
I have no control over.
No control. So self-control, self-regulation, to me, is the key to happiness.
So, mind control, as you stated, in the positive sense, is key.
Yes.
To total wellness.
Absolutely. It's changing the things you can and choose to change. But as I developed from these 350 books that really focused my attention on self-regulation, I of course learned to be in present time. That's number one. Number two is relaxation, and there are thousands of tools for relaxation. From breathing, a basic control. I actually trained myself slowly to be able to slow my breathing to one breath a minute. Now, and when you get that, you're in a very deep state. You can't think about anything else. And I'm not recommending that everybody do that. You know, I like to play with these things. So relaxation is the second key. But no matter how good relaxation is, if you don't handle your unfinished emotional business, the minute you come out of the relaxed state, you're all over the place again. So I developed tools, mental imagery tools, for changing sensory feedback from the body. See, emotions are not mental. Emotions are physical feelings that we get as a result of something up here. And so the feeling produces either calm, okay, or stress. I mean, that's it. Now, there are all kinds of subdivisions in there. So I developed a whole series of techniques for learning to change the sensory feedback from the body. Talk to the body. That's autogenic training. Love the body. A lot of people, when they have a problem, actually are angry with their body. You can't afford to be angry with your body. It's you know, not very healthy. Learning to feel the pulse. Every cell in your body pulsates every time the heart beats. But if you are stressed, the autonomic nervous system that runs all of the heart and the blood flow will cut off blood flow to certain areas in the body. And so you can play with feeling the pulse in each part of the body, except you never want to feel it inside your head, or that can cause a headache. And then you want to learn to breathe through the skin. One of the most powerful tools for controlling pain is to imagine, and start with your hand, and imagine you're just breathing in and out through the hand. At 15 to 20 minutes, the hand will become total anesthetic. And that was one of my developments that I figured out way back in the early 70s. And then you can use an American Indian technique for meditation preparation, in which you collect tension or undesirable feelings as you breathe in. You start at the feet, call it like a gentle loving vacuum cleaner. You suck it up and you do the whole body. You can circulate the electrical energy in the body, and then you can expand the electromagnetic energy field around your body. We're electromagnetic producers. And when you create a state where you expand 1 inch and then 12 inches around the body becomes anesthetic. You can operate on it. Mind is still awake. The body. Actually, in 1976, for instance, I had the only sinus infection I've ever had in my life. Long case, but I had to have fenestration of the sphenoid sinus to go through the nose, way back under here, and I said, just give me 20 minutes. And I put myself into that state of consciousness, and I said, okay, I'm ready. And they actually went through here, cutting bone and sucking out. And I'm sitting there, I could hear the noise, and I could feel movement, but no pain.
Really?
That's how good it is.
Okay.
And so you could train yourself to do that.
So, pain management. Somewhere I read online that you had noted that pain is like the black dwarf of this universe. You know, we know it's there, but we're not quite sure what it's about.
Right.
And so in a way, medicine kind of dances around pain management.
Well, because most physicians are really afraid of the nervous system. I'm serious. I mean, they don't want to go there because they don't. See, I've always been fascinated with nervous system. When in first year in college, in medical school, neuroanatomy. Wow, I went wild. I loved it. out of 82 students, I was the only one who liked neuroanatomy. To me, it's the most fascinating subject in the world. And the brain is, in my opinion, the most remarkable creation that we know. The mind and the brain are clearly above anything physical. And so what we can do with our brain is so phenomenally creative. I believe that it is possible to overcome probably 95% of all illnesses if the person is willing to put the mental effort into it. Now, that being said, I have one belief that really freaks out some people. I think that many times the problems that come up are related to unfinished business, not from this life, but from a previous life. So I don't believe in reincarnation. I know that this is the way it is. And so often, if I can't get through to a patient any other way, I'll do a past life therapy session. Sometimes 1 hour is enough to give them the insight they need to get over something.
Into some unresolved issue in a former life.
Yeah.
Yeah.
Manifesting in a new accident or encounter in this life.
Yeah. No, so I'm a novice at all this, but in my life, I've seemed to encounter people that I would describe as troubled souls. They just,
Oh, yes.
you know, they seem to have some fundamental problem. And you're suggesting that it's a past life, unresolved. It might be more likely than not. It's something in the former life that they're now
Yes.
carrying forward into their current lives.
Now, whether or not that will manifest in this life begins at the moment of conception. If the pregnancy is not desirable or desired
Desire,
by the mother especially,
unwanted pregnancy.
unwanted pregnancy,
Yeah.
40% of children in this country are born out of wedlock.
Yeah.
I can't imagine that 99% of them are wanted. I doubt even the 1%. Now, so the mother doesn't produce oxytocin. The whole, ordinarily, if I just reach over and shake your hands, unless you don't like me, we'll each have a little burst of oxytocin. There's nothing, and it's just, that's bonding. It's natural human behavior. So she doesn't have that because she's worried for 9 months. Even if the pregnancy is desirable, if she's put to sleep, the big surge of oxytocin comes during delivery. It's blocked. Even if you get a spinal anesthetic, it blocks that big surge of oxytocin. So the child comes with a deficiency of oxytocin. Even if all those things up through delivery are normal, if there is a major trauma in the first 7 years of life, it can block oxytocin for the rest of the life. Having worked with all these patients, most of them tell me they've never been happy. They don't remember happiness. And often, what is the most common major trauma in the life in the first 7 years? Divorce of parents. 50% of all marriages divorce. Now, not all of them in the first 7 years, but still, it's a big hunk.
Yeah.
So as I see it, about 80% of people are unable to bond naturally. Period. And they
Bond with others, bond with themselves.
both.
Right.
To me, in my opinion, healing begins at home. I believe, my number one belief above all is that our number one need is to help other people. But if we did not feel adequately nurtured, then we want nurturing more than we can give nurturing sometimes. Now, one of my favorite statements is, I did not have the courage in this life to choose abusive parents. I was over-nurtured. I don't mind that. It's a little trouble sometimes when you're growing up,
Right.
but never a big one compared to other things.
Yeah.
So we now know that every known psychological emotional disorder is associated with oxytocin problems. Addiction, autism, ADHD, depression, anxiety, borderline personality, inadequate personality, and even schizophrenia. Every one of them is associated with low levels of oxytocin. Now, over the last decade, there have been numerous studies where they have used nasal sprays of oxytocin, and they work in every one of those situations. The problem is it has to be done 3 or 4 times a day because it's not producing anything in the body, it's just an external, and it's used up. The body just loves that oxytocin. Well, it gets a little expensive, but also nobody's done it long term.
Yeah.
And everything I know about spraying something in the nose, it's going to cause nasal mucosal problems.
Some problems. Yeah.
And so that's why in 2011 I discovered that I could stimulate in the body, anybody's body, almost everybody's body, the production of oxytocin by stimulating 13 specific acupuncture points, which I call the ring of air. For instance, in July, I did one of my ongoing experiments. One man came in with 0 oxytocin in his blood. Stimulated the ring of air. 30 minutes later, his oxytocin was 10.6. The normal range is 5 to 18.
She was right in the mid-range.
Exactly, within 30 minutes. There was a woman in that same study who 0, hers only came up to 5.8, but still, from 0, that's pretty impressive. And my favorite 2 stories are a 12-year-old with autism, brought to me by his parents. I couldn't get within 3 feet of the kid. He was that withdrawn. So I spent an hour talking to him and his parents. 2 months later, he came in and hugged me. I mean, that's really gratifying. I have, for 2.5 years, had correspondence with a veteran who had post-traumatic stress disorder for 10 years. Horrible nightmares every night of his life. The first night that he applied this essential oil to these 13 points, no nightmares. I hear from him 2 or 3 times a month. I just heard from him last week, and he hasn't had a nightmare. And so it's that good. Now, nothing worse than 100% of people. In fact, just a couple of weeks ago, I presented at the Southern Medical Association my study just on depression and anxiety. 80%. Just this alone. 80%. There's not a drug in the world that's 80% effective for anything. The only thing I could say might be 80% effective in killing you would be arsenic or something like that. But in curing something, getting rid of depression or anxiety, there's not a drug in the world that can compete with it.
Yeah. Well, let me ask you a couple other things. So pain management, oxytocin, I guess you'd say past lives resolution or something. What about anger and laughter or joy? Are those important? Or?
Well, anger, in my opinion, holding a grudge, because anger always based on that. Holding a grudge is like taking poison and expecting it to kill the other person. You cannot afford the luxury of anger. Now, I didn't say you should not get angry. I think it's important to protect yourself when you're threatened. But if you can't resolve it, you need to detach in some way. Now, laughter, well, I can only say my kids grew up being terribly embarrassed. I have a rather raucous, loud laugh. I laugh at a lot of things. I find it funnier, things just odd, and I laugh at them.
Yeah.
I just did this radio show yesterday with Lisa Garza, a wonderful interviewer. And she asked me this one question, and I said, well, I've always said you can have sex in public square if you know what to call it. Now, she's the only person. She now published that. I sent an email from her this morning, but most people too embarrassed to go near it. Well, I broke out laughing when I read it in the note this morning, but, it's just one of my little quips.
Yeah. Well, my friend, some colleagues and I, we're developing a taxonomy of theories of aging. And so one of them is what we call the ludic theory of aging, is that as you get older, things that you see or experience remind you of something funny from your past.
Exactly.
And you start chuckling. And then as you get older and older, people think you're losing your mind because you're just laughing all the time. But it's really just
Yeah.
the ludic theory of aging.
Yeah, I agree. Interestingly, the study just got yesterday with people's thoughts about what old is.
Yeah.
And the 18 to 20-year-olds have a totally different age. 50 is old. And when you get to 75 and, older and older. To me, old is 100 and past.
Another thing I want to ask you about is, does place matter in your overall well-being?
Well, of course, just a lot of things matter in that. I mean, there's a lot to do with nature in a place, for instance. I mean, I've lived on a farm as an adult since 1969 by choice. Mm-hmm. I don't want to live even in little Pleasant Hope, 690 some odd people. I want to be in this nature area. So it matters a great deal to me. And there's no question, it's good studies showing that living in a city is stressful. It is far more, even a city the size of Springfield, far more stressful than living out from it. Unless you're afraid of being alone or by yourself or in nature, but that's a rarity, really. Most people will prefer a natural source. One of the things about this whole area is, the southwest Missouri geographic area, it is one of the nicest natural places on the earth.
Mm-hmm. We need to keep that a secret.
For years, we don't want everybody to move here. You're welcome, but.
We'll edit this out of the recording.
It matters a great deal. And my feeling is job, relationships, location, all of those are critical. Mm-hmm. And you need to be sure that they fit you. Mm-hmm. Now, there is another aspect of this personality thing that is not related exclusively to oxytocin, although to some extent it is. And that's something that came up the same time I was developing my work on oxytocin, and that's conscientiousness.
Okay.
There's a wonderful book called The Longevity Project, the longest scientific study I know in history. 80 years. 11-year-old kids were chosen, 1,500 of them in San Diego, by teachers for psychologists who wanted to study personality. They were followed for 80 years. Personality tests year after year after year. Actually, 3 teams had to finish the study. Mm-hmm. The original guy died in the 50s. At any rate, they finished, they started in 1921, and they finished about 2001. And it took them another 10 years to put all the data together. But it turns out that 75% of longevity and health and income are related to conscientiousness. And conscientiousness, to boil it down, is really organized and responsible. There are many other subdivisions, but those are the 2 key ones to me. Now, they felt that 75% were genetic. It's a little higher than most other studies, but then there are not other studies that go 80 years either. So, and my feeling about the genetic component is, and it's real, it's unequivocal. Mm-hmm. If your auntie where man should be your uncle, that's how big the word if is. If you can get the person to really work with you in a transgender, transgeneration way in a past life session, they can sometimes turn out. Because we now know that you can change the manifestation of your genes with habits and thinking.
So you've endowed a chair at MSU in conscientious psychology. What do you hope happens with that program?
Well, I hope that person will do work not on people who are conscientious. We know a lot about them now. I would like to have that individual study the unconscientious and how to motivate them to become conscientious. Mm-hmm. I have lots of ideas.
Yeah, well, share some of them with us. How do you take a person who's, different age, we would call them a ne'er-do-well, a slacker, clueless, never shows up on time, never, always goes through toll booths without paying the toll, just a freeloader,
significant portion of people today, I think.
What do you deal with?
Well, first of all, of course, you've got to have access to them. You've got to either have them in an incarcerated situation where you could do it. And there have been some excellent studies on just biofeedback in prisoners, by the way. Elmer Green, the father of biofeedback's daughter, Pat Norris, did her doctoral dissertation working with prisoners, just teaching them self-regulation. The recidivism rate over 3 years was 12%. As you probably know, the ordinary recidivism rate is about 95%. So if you can get access to them. Now, ideally, I'd like to get access to them in the first grade, in grade school. And I don't know how you do that, but it would involve, of course, let's say they are a young adult, and I'd like to give them a bath in air bliss, but if I could just put it on them. I think that could change their consciousness enough then to work with them. And that would just be a small part of it. I love vibratory music. As you know, we've got several vibrating music beds here. I think exposing them to certain music is very worthwhile and things like that. I'm about to work with a new gadget that has both light and sound and vibration in the same unit. So I think we know you can affect consciousness with color and light as well as sound. I believe that a much shorter program than the one I do with chronic pain patients could help to retrain the brain and make people feel good about themselves. But that's the number one thing. They've got to feel good about themselves.
That's the base of conscientiousness, is you
Exactly.
feel
I'm okay, but
I'm responsible.
I'm responsible.
I'm okay. Yeah. So you think that basically there's possibilities to teach and train conscientiousness.
Exactly. Now,
If we
nobody
could just identify them and get them into a situation where teaching and training can occur and be effective.
Exactly. I mean, for instance, I'd like to start with Greenwood.
Yeah.
Of course, most of those kids are probably pretty good already.
Yeah.
Just the fact that they're at that particular school.
Yeah.
But it's one school where there must be a few who are not optimal.
Pretty easy to identify an unconscientious person.
Oh, yeah. Yeah. Teachers would know.
Yeah.
The teachers know the first or second day of school.
And the public school system is a whole other topic. But I think back in and I'm not an expert, but I think back in the day, they'd often track or tag students based on what they consider their IQ.
Exactly.
Should we be tagging or grouping students based on their conscientiousness at that point in their lives?
I'd call it the personality quotient instead of the intelligent quotient. Right. Because, the vast majority of children have an IQ of 90 or above. And if you've got an IQ of 90 or above, you can do okay. You might not be a genius, but 90 and above, you're going to do okay if you apply yourself. And so, I think we should be looking at not intelligence, but personality quotient. And that number one thing is conscientiousness.
Okay. So the Missouri State University Libraries is happily gearing up for this new person and what he or she will be working on and teaching and doing. So one resource we've identified is the Wiley-Blackwell Handbook of Mindfulness. And we're trying to crowdfund the money that we need to get this as an electronic resource because then it's available to MSU people anywhere, anytime. How does mindfulness fit into all of this?
Well, mindfulness is essentially consciousness to me. A person who's not mindful not only is not conscientious, they're not conscious. And not conscious to me means they're not paying attention to the essentials of life and people. Now, interestingly, you may not want this thing, but you can take it out. I actually have guides, and I get communications with entities.
Uh-huh.
I asked one of my guides 25 years ago, what percentage of people are conscious? The answer was 6%. And that means they're thinking about the kinds of things we're talking about.
Mm-hmm.
Most people live a somewhat robotic life, and they're not paying attention. I think I've always paid attention. I was born this way.
Yeah.
And of course, I had the parents that encouraged it and allowed me and helped me to develop it. But for those who don't, I think they need to be made aware of that basic need to help other people. Again,
So caring maybe is
caring,
empathy.
empathy, absolutely.
Yeah. You also mentioned attention, and as I think back on human disasters of anything, an auto accident, an airplane goes out, when you get down to it, somebody wasn't paying attention.
A study done back in the 70s showed that 80% of automobile accidents were because of people being careless, not paying attention.
Okay.
And the other 20% about somebody else not paying attention.
Yeah. So this is very interesting. I'm also intrigued by. Well, let me back up and ask you. Living in a city, any city, is really not optimal. Drugs and surgery are really not optimal, and yet the vast majority gravitate to these things. Even demographically, I think worldwide now,
Oh, yeah.
urbanization. Urbanization is really people going to urban areas.
Yes.
Is rampant.
Well, the last 300 years, I mean, that's all over the world,
Yeah.
the way it is. Basically, I sense that getting in touch with, again, one's own unfinished business, anger, guilt, anxiety, or sadness, depression. There are hundreds of synonyms, but those are the big ones. And it's getting in touch with those in yourself and finding a way out of it. And there's not a drug in the world that can change it for you. There is a place for surgery. There's a place for drugs. But in chronic illnesses, I would guess that what we call the alternative or holistic approach is far safer and far more effective. Hypertension. 40% of all Americans have high blood pressure. 40%. I can control that 97% of that 40% without drugs, safely. And so the same is true. I can't do quite as well with depression, but 80%. And so once you know that these alternatives work, actually, I think maybe the only good that is going to come out of the mess called Obamacare is it's so bad that many people are going to be forced outside the system more than were before.
They'll explore their alternatives.
Yeah.
More rigorously.
Because they can't afford, they can't put up with the nonsense of the bureaucracy, et cetera, and that's good. As a matter of fact, because of all of that, two of my physician friends and I, in January, are starting the National Institute of Holistic Medicine right here in Springfield.
Congratulations.
Because we want to offer the broad field. And I think it's a need that we have to readdress.
Yeah. The complete person.
Yes.
So I got to ask you another question about the idea that pain was sort of the blind spot in medicine. I have a similar theory about information, is that it's central to our lives, and yet we know so little about how information works. And how do we become informed? And I'm a librarian, and we're in a library, and librarians would say, that's where the information is, back on that wall there. So they've objectified it. It's an object out there that we must find and preserve. And again, it's like drugs and surgery. There's a place for preserving information out there. But I don't know, maybe is there any studies of How does a person become informed?
Well, I think, again, you have to be responsible for learning. I remember from the beginning of medical school, I spent hours in the library in the Index Medicus, this book this big every year.
Yeah.
And I started collecting articles related to the nervous system, so that by the early 70s, I had 25,000 reprints that I had collected. This was before the internet, of course.
Right.
Well, I eventually donated them to the neurosurgery department of Johns Hopkins because I had gone out on a twig.
Yeah.
And I probably still have now another 20,000 reprints from things I picked up in since then. But I actually spend several hours, maybe more, every week on PubMed. You know, millions and millions of articles. And
Just browsing and following lines of interest?
Exactly.
Yeah.
I want to find out, is there scientific outcome on this approach? And if there's not, well, I can't do the research most of the time myself, so people ask me about these things. If I can't find an outcome study, I can't endorse it, and I can't support it. I can say, well, it'd be nice to get research on it, but it's that kind of thing.
And toss out the idea, the need for a line of research.
But to me, one of the reasons that I collected all these books, and I've got a similar amount up at my house, is that I love books. I probably read 100 books a year, and I want them in a print form. I have to admit, that's my. Now I did every once in a while, like yesterday, there was a book I could only get for $135, one out of print. So I took the PDF.
Yeah.
But otherwise, I want the copy of the book because I adore books.
Yeah. And I think there's been some research that the way we interact with paper is different than the way we interact with screens.
Oh, absolutely.
At a fundamental level. It's not like
No, very, very unequivocal.
Originally, I thought, well, it's just because we're so accustomed to dealing with paper that we'll eventually learn how to glean as much information or become as informed through screen interaction. I'm not so sure.
I don't think so.
Yeah.
I could be wrong.
Yeah.
I have the feeling that it's like television. Television is distracting, captivating some people, but I don't think you learn as much from television as you from radio. I'd rather hear something on radio than actually see it on a television screen. I know
I'm that way with, if I'm going to go see a motion picture that's based upon a novel, sometimes I actually often think, especially if I like the novel, I'm not sure I want to see the motion picture because then it fixes in my mind
a different image.
What I imagined as I read the novel. And I can't go back to that pristine state where my imagination ruled. So Tom Joad will always be Henry Fonda now because I've seen the movie, The Grapes of Wrath. And so it fixes your imagination on that particular
No, I agree
reading
totally.
experience. Yeah.
I mean, it isn't that there aren't some good movies, but I will not go and never have been interested in going to violence.
Yeah.
I don't consider it artistic or value whatsoever in the human race.
Yeah.
Now, music, good music is wonderful, and comedy. But there are no other movies that I'm even willing to think about.
Yeah. Coming back to mindfulness, so if we are able to generate enough interest and support to acquire this handbook on mindfulness, do you think could it be beneficial?
Yes, I looked it up on the internet, and obviously I can't get the details, but the authors are outstanding people in this field. And, people need to do this kind of in-depth evaluation of the research that's already been done on mindfulness. So I think it's a great deal, and I'll be the first to contribute.
Okay. We got that on tape. One final question. All I know is what I've been able to see online about this handbook that was just published, I believe, in April of this year. So it's 8 months ago. They talk about the East-West, different perspectives on things. And what's your take on, oh, this is an Eastern way of doing things and this is the Western way of doing things? Is that a good way to make sense of
No.
reality?
No, I think that basically there are words and, of course, other habits that creep into these things. But if you look at the foundations of mysticism in the West, it's right there. You know, I call religion the fight for God because all the churches fight among themselves. And I call mysticism the search for God. And I consider mindfulness part of the mystical journey of getting in touch with the divine, whatever one wants that to be.
Okay. Well, thanks very much. We've been speaking with Dr. Norman Shealy, who's truly an extraordinary physician and healer and mindful person. Thank you very much.
Thank you.